There will be an opportunity to ask questions of each of our speakers. They'll be presenting for about 15 minutes. And at the end, if you have a question that you'd like to ask them, at that time, I would encourage you to unmute yourself and ask the question directly to them. Or if you don't feel comfortable asking out loud, you're most welcome to type it in the chat, and we'll be moderating the questions as they come through. So for now, if you wouldn't mind just muting yourself to make sure that we don't interrupt our speakers as they're moving through. And I'll begin with introducing our first speaker, Dr. Monalisha Sahu. Dr. Sahu is a medical teacher and a researcher with more than 12 years of public health experience. She's currently serving as an associate professor and head department of occupational health at the All India Institute of Hygiene and Public Health under the Ministry of Health and Family Welfare for the Government of India. Here, she's currently involved in teaching, training, and research activities of occupational health for medical postgraduates for courses like community medicine, epidemiology, the DPH, paramedical, and allied science courses. She is also a course coordinator from the Foundation of Occupational Health and many other short courses for training of medical professionals. Please join me in welcoming Dr. Sahu. The floor is yours. Dr. Sahu, we just need to unmute yourself if that's okay.
Thank you, Dr. Alberto, for such kind words. So today I will be discussing various physical hazards in construction.
Dr. Sahu, will you share? Perfect. Okay, slides are there. Thank you.
Yes. So firstly, I will be discussing that as we all must be knowing that construction sites are inherently very dangerous environments, and death in construction workers is 3 to 4 times higher than that of in other occupations, because they always work in a very hazardous situation. Various kind of physical hazards, chemical hazards, radiation, sometimes radiational hazards are also there, and then ergonomics hazards. So I will primarily deal with the physical hazards they face, and one of the most common physical hazards, which specifically in tropical regions they face, is heat hazards. It has been seen that they often work outdoors during the hottest times, and more than almost 50% of the workers, they didn't have any cooling measures like fans, air coolers available at home, and even during summers. They also work in non-climate controlled spaces and may be exposed to heat sources that are part of their work processes, like welding and cutting torches, and roofing kettles and paving machines. So due to these factors, construction workers are a major group suffering from heat-related illnesses. Apart from that, in underdeveloped world, another thing is construction workers are the major workforce which is working in the unorganized sector, and so they are devoid of even the basic amenities in many places. So in such situations, heat related morbidities are very common, especially with global warming and rising heat waves. This problem has increased among the workers. So if I talk about India, more than 191 billion potential labor hours were lost due to heat exposure in 2022, and it is almost a 54% increase from 91 to 2000. Also, more than there was no large source data, but small studies done in various parts of country, and it was seen that more than 20% of the people, they are having health impacts due to heat-related illnesses, heat stress, which ranges from skin rash to heat stroke. And almost 40% of the workers had reported symptoms like heavy sweating, intense thirst, dry mouth, which are consistent with dehydration, and some have also reported neurological symptoms like headache, loss of coordination, fainting, blurred vision, etc. during the summers. So the question arises, what affects the core body temperature? The core body temperature must be maintained within 1 degree or 1.8 degree Fahrenheit of the normal, that is about 37 degrees Celsius, in order to continue to function normally. So above this temperature, the body is physiologically not able to cope up. The factors that influence the ability of the body to maintain a normal core body temperature are influenced by air temperature, humidity, skin temperature, speed and temperature of the air, and radiant temperature in that particular workplace, and more importantly, by clothing type and amount, and also the hydration. And not to forget, even few individuals are more susceptible than others. So now coming
Dr.
to
Sahu,
what actually.
I apologize to interrupt. Is there your slides
Yes.
for some reason are not advancing? Would it be possible to just double
Oh,
check them to make sure they're
ये जैसा
presented?
इसको आगे करो तो थोड़ा.
Thank you
So
so
if
much. Yeah, there we go.
yeah, then I think the presentation mode is not working, so I'll keep it in the slide mode only. So what are what is actually the heat stress? So the heat stress is a combination of workers' exposure to heat from physical activity, environmental factors, and their clothing. So that will result, because of all these reasons, it will result in the increase in the body's heat storage, and the body will be providing a physiological response to this heat stress, which is known as heat strain, to increase the heat loss to the environment in order to maintain a stable body temperature. When the heat stress is unrelieved, then it may cause the various HRIs. The HRIs, they may range from heat rash, heat cramps, to some severe ones like heat exhaustion and heat stroke. According to one study, almost 10 to 20% of the construction workers suffer from heat-related illnesses in India. Now, when we talk about heat stress, uh, there can be little minor issues like heat rash, muscle cramps, and some signs of dehydration, which can be treated by taking a break from the work and drink water and correct the dehydration. And then it may also result in some serious illnesses like heat exhaustion and heat stroke. When heat stroke occurs, it is very important to seek medical assistance, because heat can kill, and it may lead to emergency situations, and it is very important that we seek for help. So how to prevent workers from heat-related illnesses? It is very important to take time to acclimatize for worker, to stay well hydrated, especially in summer months, to watch for the signs of various heat-related illnesses for which a buddy system can be devised, and to take time to rest and cool down. So acclimatization. For acclimatization, it is suggested that rule of 20% can be followed, because acclimate, if we fall, which is actually increasing the time in the heated environment by 20% each day. This kind of activity will help in acclimatization, which will be the result of a beneficial physiological adaptation, that is increased sweating efficiency, and so body will be able to maintain the temperature in a better way. So over in a period of 7 to 14 days, the exposure to heat should be increased. Then another important part is to set up a buddy system that check your workers routinely to make sure they make use of readily available water and shade, and they don't have heat related symptoms, because sometimes heat related illnesses may result in confusion, and the person per se may not be in a position to inform the authorities that he's feeling or something odd, or there is any heat related symptoms. So it is also important to schedule and encourage frequent rest breaks. Another thing is clothing and hydration. Clothing and hydration is also very important, because there are certain, especially in the summer seasons, the cotton clothes, they can be soaked in water to aid cooling. And one should also be aware that many a times the personal protective equipment they are using, they also increase their risk to heat stress. So we should encourage workers to wear clothing which is breathable, which is light color and loose fitting, so that they are comfortable, and they should be encouraged to drink plenty of fluids, on an average, let's say 1 cup every 15 to 20 minutes. Also, the third thing is water, rest, and shed. So they must rest in the shade. They must take water every 15 to 20 minutes when they are working in a hot environment. And of course, like we discussed, they should watch out for each other and wear hats and light color clothing for presenting themselves from the heat. And even after taking care of all these things, if somebody is facing severe symptoms due to heat, so the management must be prepared for emergencies. So the emergency number should be displayed, because in many countries there are different emergency numbers, and some industries, they are in collaborating with certain hospitals. So it should be displayed in the areas where where it is easily accessible to workers. And if someone in the crew has a symptom, then they can just call the emergency. They can take the person to a airy and cool place, preferably in an AC area, and then give them little water, loosen their clothes, and they can put ice packs in their groins or underarms, or soak his clothes with cool water. We must remember that heat kills, and so it is important to get help immediately. Now I'll be coming to the second kind of hazards which are faced by construction workers very commonly, that is noise hazards. I'm showing this a structure of inner ear, where this is the reason which is most commonly damaged because of loud sounds. So how much noise a construction equipment generally generates? So it can range from uh, very low to very high. Like the ICOH recommended exposure limit is 85 decibels, and in India also, as per factories law, 85 decibels and above, they are the levels at which legal action should be taken based on the average waited time. So I have shown this like hammer drill, 114 decibels. So these are the various noise. Now, what is a noise? Noise is any unwanted sound which is a byproduct and which is uh, not welcome. So exposure to any kind of noise may lead to various kind of auditory as well as non-auditory effects. The first of the thing, why noise is a problem in construction workers. So it has been seen in various studies that worldwide, almost 51% of the workers in constructions have been exposed to hazardous noise. And it is high, and between 60 to 70% of construction workers are exposed to a noise dose higher than 100% of their exposure limit. And its effects may relate to auditory effect as severe as acoustic trauma and rupture of eardrum, and non-auditory effects like heart and circulatory diseases, nausea, vomiting, irritability, fatigue, accident and error, insomnia, and peptic ulcers, and many more. So it has been seen that many US has quoted that 52% of the noise exposed construction workers report not wearing any kind of hearing protection, and 14% of them have some or other hearing difficulties. 25% of noise exposed tested construction workers have shown a material hearing impairment, and almost 16% of them have hearing impairment in both ears. In India, situation is no better. Here also, only 15% of them, of the construction workers, are aware of any kind of personal protective earplugs, and the usage of personally protective devices was really low and almost non-existent. So how do we know that if there is a problem? So if in any situation we think that the employees have to raise their voices to carry out a normal conversation when about 2 meters apart, if the employees use noisy powered tools or machinery for more than half an hour each day, and the noises due to impact such as hammering, dropping, forging, pneumatic impact tools, or explosive sources such as cartridges are being used, if any answer of all this question is yes, then you must need to assess the risks and decide what should be the further course of action. Symptoms can be, initially it can be like conversation becomes difficult, or Family complaints about the television being too loud, you have trouble using the telephone, and you find it difficult to catch sounds like T, D, and S. So you're confused with the similar words, and then it may result in permanent tinnitus. Actually, when the hair cells, it is like a lawn. When a heavy instrument is moving over a lawn for sometimes the grasses, when the impact is high, after some time they may regain their strength and then they stand back. But if constantly a very heavy vehicle is going on, then sometimes they may not stand back on their own. So in the similar manner, the hair cells of the basilar membrane with uh, regular exposure of loud noises, they become permanently damaged. So by the time they are still in the position to gain back their strength and stand back, they are causing NITTS, that is noise-induced temporary threshold shift. It is elevation in hearing threshold after exposure to noise, but it revives gradually. But after a certain level, it is NIPTS, or noise-induced permanent threshold shift, and then noise-induced hearing loss, NIHL, in which the hair cells are completely damaged and they are not able to regain their strength back. And the characteristics of this kind of hearing loss is uh, at audiometry, they are at 4000 hertz, the sensitivity is lost, and then it may extend to higher and lower zones also. So to check the situation of their hearing ability, it is very important to do audiometric tests, and a baseline audiogram must be performed within first 6 months of work exposure, and after that annual audiograms should be done to assess whether the workers who are working are getting noise exposed and they are facing uh, hearing problems. So these are ranges of permissible level as per Factory Act in India, and in different countries it may be different. So how to prevent and mitigate? So as we know that elimination and substitution are best, but if it is not possible, then administrative control like limiting the work duration, there should be quiet zones for breaks and recovery. There can be engineering controls like equipment selection, equipments which are quieter, which are good and well maintained so that they produce lesser noise. There can be barriers and enclosures to the noisy equipments, and there can be dampening materials. Also, when these kind of engineering controls are also not very useful, or they are limited to certain extent, one must use earplugs or other personal protective uh, equipments based on their level of comfort. Lastly, coming to the vibration hazards in construction industry, this is also one of a serious hazards faced by construction industry workers, but which is less talked about, and there is very less data available, especially from India, because many people are totally unaware, many workers are totally unaware what are these vibration hazards and the ill impacts. So especially workers who are working with machinery and tools like concrete breakers, pokers and compactors, hammer drills, so they face various kind of vibrations. They can be limited to certain part of the body like hand and arm, or they can be whole body vibrations. When it is limited to the hand and arm, then it may cause tingling and numbness and pain and discomfort, and in longer duration of exposure, it may it may cause into reduction in grip strength, and it may result in carpal tunnel syndrome. Similarly, if the whole body vibration exposure is there, there is initially fatigue and tiredness, body and muscle pain, irritation, difficulty sleeping, and then if in a longer duration it happens, it is very high risk of various kinds of MST. So it is important that on a regular basis, the workers who are exposed to vibration, they wear suitable protective equipment. Even it has been seen that if in one room there is a noisy vibrating machines, so it may cause noise hazard also in the other room. So if in casing or vibration isolators are reduced, then the noise is also reduced in the other room. So these are various kinds of tools which can be used, like rubber dams, anti-vibration mounts, which can be used as vibration dampeners, and they can improve the workers' safety towards vibration, and also they should be encouraged to change position often and take breaks. So with this, I would end my session. Thank you all. These are some references, and I can take questions at the end. Thank you.
Yeah, absolutely. That was fantastic. Thank you so much, Dr. Sabu. You really challenged us to think about two really provocative topics, right? And climate change and heat, and how workers are exposed to heat in the ground, as well as physical hazards, as noise, and hearing and hearing impairment is so important, particularly as we age. That's necessary to make sure that we're safe while we're on the construction ground. So thank you. So this is an opportunity to ask her any questions that you all may have. So if you feel courageous and you want to unmute yourself and ask a question out loud, please do so. Or if you're a little more shy and you'd like to ask a question through the chat, you can do that as well.
So I think there are no questions, maybe.
So there's no questions at this time, but let me see.
They can put it always in the chart, and we can deal with them at the end also.
If I may ask a question,
Please,
Alberto.
please.
Yeah, madam.
Yes,
See,
Dr. Sen.
actually, what is happening in construction industry, in some of the places, for example, when you work in overseas, am I audible? Those who are not speaking can kindly mute. May I request everyone to mute? There's some background. Yeah. So what, we are finding, migrant workers, most of the people are migrant and they are completely new to the environment. We had some challenges, like those who are not accustomed to, say, for example, the summer of Saudi Arabia, for example, and traveling from India. They find it initial few days difficult, and if it is in summertime, then so what do you have any suggestion for acclimatizing these people in a systematic way so that they are not much affected? So, do you have any suggestions for the acclimatization?
Yes, Dr. Sen, thank you for your brilliant question. Now, this problem, when we also go to the construction sites for our uh, research or our visits, we have also found it, because we mostly go to the unorganized sector and people are not ready. So in this part of the world, very specifically, I would like to say that there is general lack of awareness among the workers. Many workers, especially the migrant workers you are talking about, they are coming from an area and from a social strata in which they are not very aware, and they do not have, many a times they do not have access to the protective equipments, and also they do not know about acclimatization. So first of all, if we can generate awareness before taking any measures, it is very important to train the workers also. A small duration of training, at least, when we can talk about various hazards, what are they, specifically about the clothing, and specifically about maintaining hydration. Because you will see many a times when worker, they works in height, in the morning they will take a bottle of water, they will go up, and then they won't come down, and the bottle of water is over. But so that their work is not hampered, they're not coming down. So first of all, it is important to make them aware that where it can go, how much dangerous this habit can be. And so when they are aware of that, their clothing and their hydration, they can maintain. And then about buddy system also, as we talked in our session, in some of my slides. And then as we discussed, the plan of acclimatization, it is better if the management itself in summer months plans some rotation, that the new workers are sent to the site which are specifically in summers, which are hot, and during the daytimes, which are the hottest hours during the whole day. Let's say one day only 20% of exposure, and then day by day, based on we in some other session also I was asked this question, that what is the general rule. So the rule we have said, like, okay, we from various agencies, that okay, 20%, but that 20% may not be true for everyone, because everyone is different and individuality has to be maintained. So yes, we talk about okay, 20% exposure to be increased with each day till 7 to 14 days, so that the acclimatization is better. But of course, the feedback has to be taken from the worker, how he is working, and the areas which are hotter, it is to be asked from the fellow workers also, whether the worker is losing consciousness, or he's behaving weird, or he's sweating very much, because initially they sweat very much, they feel tired, and then that response is lost. So I think that should help.
That's wonderful. Yeah, and I appreciate you highlighting interventions at the organizational level and at the worker level, right? So there's opportunities to support acclimatization, both from the worker perspective and the organization perspective. That hopefully synergistically that helps, in the reduction of that hazard. Thank you. So in the interest of time, we'll go ahead and move on to our next speaker. And I want to make sure if there's additional questions for Dr. Sahu, I know some folks are posting those in the chat. If time permits at the end, we'll loop back to our full panel and ask all these questions. Okay, so it's my privilege to introduce our next speaker, who is Dr. Babak Mamarian, who serves as the Director of Safety Research at CPWR, which is the Center for Construction Research and Training in the USA. He currently leads a NIOSH-funded project titled Prevention Through Augmented Pre-Task Planning that aims to enhance the quality of job hazard analysis and pre-task planning construction. He holds a PhD in construction management from Arizona State University, a Master's of Science in Civil Engineering with a concentration in construction engineering and management from Oklahoma State University. His personal research interests involve the development of high reliability work systems with a focus on safety and health, risk management, and performance improvement. Today, he's going to be talking to us about exposure control and construction solutions database. Please join me and welcome Dr. Mamarian.
Thank you, Dr. Alberto. Good morning, good afternoon, good day, everybody around the world. So, yes, we are located in Maryland, in the United States. I am Babak, as Dr. Alberto introduced. I'm Babak, the Director of Safety Research at CPWR, the Center for Construction Research and Training in the US. We serve as the National Construction Center in the United States, located in Silver Spring, Maryland, outside Washington, D.C. area. And we serve as the National Center through a 5-year cooperative agreement with NIOSH in the US. Today, I will talk about 2 products that we have. I think they're very well related to what Dr. Sahu just presented through her very great presentation. But before that, I would like to introduce my colleagues on this project. Sarah Brooks, who is our industrial hygienist at CPWR. She manages our exposure control database that you will learn more about it today. And Chris Lee, who manages our solutions program and database that I will also talk about that website and database a little bit further. So these 2 projects, or these 2 websites, are part of the CPWR websites that we have. We have multiple websites at CPWR databases that everybody can use and access them. They're all publicly available, free of charge. So the first one is our exposure control database, and this is a searchable database for 4 major health hazards. including silica, welding fumes, noise, and lead. This is a very basic, easy to use database that everybody can use. You can just go to the website. I have provided the link that everybody can go and try and see how it works. And today I will have a quick walkthrough of this website to see how it works. But before then, I would like to provide a little bit of information about it. So we developed this database in collaboration with ICOH, OSHA, union representatives in the US, and also academic professors to develop something which is easy to use for practitioners, mainly as a planning tool. So if they are planning to do a project or if they have a task, they're planning to perform the task, they can use this database to predict worker exposure to one of these hazards, if there is any exposure, and if they think or if they are concerned about any of these hazards during the task, they can use this database and this website to predict the potential exposure. The data that we have used to develop this database came from peer-reviewed articles, published reports by the US government, and some private entities who shared their data with us. So we built this database initially on those data. So, and I will discuss the challenges that we had and how we tried to tackle them. So as I said, this website and this database is publicly available. And as you see, the number of measurements that we have for each branch of hazards that we have in this database, obviously silica is the largest one, and we receive a lot of attention for the silica because when we released this website, it was the time that OSHA released the table 1 for silica exposure in the US. So we had a lot of users. As you see, we had users from 118 different countries around the world. They access the website and they use it. So I would like
Excuse me, brother.
Yes.
We are not seeing the presentation. Sorry for this.
I'm so sorry. Can you see that now?
No, still
I
it
think
does
No,
not.
the slide mode is not working. The presentation is not working. So you should try the slide mode. I think the same problem happened with me.
So do you see now?
No.
Not yet.
We don't see
nothing
anything about it.
Let me see if I can share your slides.
Okay, I think, all right, so let's do this.
Oh, there.
Okay.
Yeah.
I'm so sorry.
worked.
Yeah, now
Alberto,
it was
did you share that?
Okay,
No,
now
this is Babak. Yeah.
So okay, you can see that now, right?
Yes.
Okay, I apologize. So just very quick, I should go back very quickly. So this is my team as I introduced them, Sarah Brooks and Chris Lee, and 2 websites that I was talking about. And this is our exposure control database that I was explaining. And then this is the interface of the database that we will explain, and we will have a quick walkthrough of this. So as I briefly explained, we have 4 major hazards in this database, including silica, noise, welding fumes, and lead. And we have users from around the world. And I will have a quick walkthrough of this website so you can see how it works and how you can access that. So just give me a second so we can have a quick walkthrough of this. So this is the interface of our exposure control database, also known as the ECD. As you see, we have 4 major hazards. It has a very simple interface that you can select the hazards. So we have silica, welding fumes, lead, and noise. And as you hover over on any of these hazards, so you can select and run a search. I picked silica because it is the largest branch that we have in this database, and we have the largest number of measurements in this branch of our exposure control. The way it works is that we have 6 drop-down menus. So first you start with the task. So we have a long list of tasks that we have gathered from different sources, as I explained, from literature, published literature, peer-reviewed articles, government reports, and some private entities shared their data with us. Let's select this cutting fiber cement siding as a task. So we see a list of tools used. And just to clarify, the tasks and tools are the ones that we were able to find from different sources. You might have a task or a tool for your operation that is not listed here. We might add that later. The reason that you don't see them here, it's because we were not able to find a data. So whatever we have here is based on the data availability. So for this activity, let's pick circular saw as the tool. Material is, of course, and let's say whether we need a control method, none. The operation was the work environment was outdoor because we didn't have any data for indoor. We might find some in the future. And data source, whether it was actual data coming from the job site or from lab and experiments. So let's see what we got from job site, from actual operations. So after we hit submit, it gives us a basic result, right? So on left-hand side, you see that the expected exposure, which is 62. And it compares that expected exposure against OSHA PEL, permissible exposure level, and the action level. So obviously it is above. It's exceeding the OSHA PEL. And on the right graph, you see the summary of the data, the distribution. So this result was based on 22 measurements that we had in the database. And it shows the distribution, how many of the measurements were above 50, how many below. So that gives you a little bit of a better picture of the data used to develop this database and for this specific task. And you see the maximum and the minimum of the exposure based on the data that we had. So on this page, in addition to this, so you can see the summary of the task you defined, the task, tool, material, the whole combination. So it's just a reminder for you. And on top of the page, we have a glossary, so you can click and see the terms that you want to get a little bit of better understanding of the definitions and descriptions. With history, you can see the last 3 searches that you had conducted. For instance, this one was the first one. And if you have done any other searches, so you can go back and see what you had done. And also we have data collection forms that I will talk a little more about this later. So these are features available on this page. At the bottom of the page, we have useful resources. So you can have access to other websites, other tools and resources available through CPWR, NIOSH, and other organizations for your specific task to learn. And also we have a list of sources used to develop this to do this calculations for this specific task, as you see at the bottom of the page. So this is our exposure control database. It's very basic. It's very simple to use. It's easy to use. So you can go and try different branches of this database. And if you have any question about any part of it, please feel free to reach out to me. But what challenges we experienced during the development of this database? The main one was data availability, because some organizations, some entities, they own the data, but they're not willing to share. Or they share the data, but the quality of the data was not there based on the requirements and different variables that we had considered for this database. We were not able to use the data that they shared with us. So the data was very inconsistent. The quality was very inconsistent. And in some cases, we were not even able to use maybe 10% of the data that we collected. So to address this challenge and to facilitate data sharing process, to streamline the process, and to kind of standardize the process, we developed data collection form and data sharing form, as you see for silica, for noise and welding fumes measurements. So these are all available through the website that I showed you. On top of the exposure control database website, you have access to all these forms. This is one example for silica that you can use if you are willing to share your data with us. So you can use this, or even for your internal use, you can easily download, print it, and use it to make your data collection process a little more standard. So this website is to predict the exposure. But what's next? As Dr. Sahu presented, so we need tools, we need resources, we need some practical tools. So estimating exposure is good. It's the very first step. But after that, we need to help contractors, we need to help practitioners solve the problem to address the hazard. What controls available? So the next resource that we have at CPWR, we call it Construction Solutions Database, that we developed back in 2010. But it was the time that I wasn't with CPWR yet. And my colleague, Chris Lee, he manages this website under our program. Construction Solutions Database is a collection of evidence-based resources for construction safety and health. But what it is? So we have about 356 of these solutions. But what is each solution? So each solution, as I said, is an evidence-based safety and health control. So for each solution, we have a description, which is a problem statement. Let's say it's a 2-pager document. So it has a brief problem statement, the description of the situation that you are trying to solve, what risks involved in the process, and how we can address the risk that we have identified in the process. But we don't leave our users at that point. To help them find products, we introduce some select products available in the US market. So we provide the vendors and manufacturers information, and I'll walk you through the website to see how it works. And then they can reach out for further information. But whether they purchase the product or not, it is out of our control, and we cannot gather that information. But this is one of the products that we have around for several years, very popular. We have many users from different countries. They reach out and they use. And the way we develop each solution is that after we pick a topic, the topic can be based on the need from contractors. They may share with us. We will see some of them that are related to heat and noise that Dr. Sahu also presented, to see what other products and solutions available to address heat hazards. So after we do our research, after we find products, after we develop and draft this document, which is called a solution, we assign 2 reviewers. But definitely we have one from industry, because we want to make sure that the document speaks practitioners' language, not only researchers. So that's very big point in our development process. So let's have a quick walkthrough of the website to see how it works and then how we can find a solution. This is the interface of our construction solutions, the database or website. As I explained earlier, all the products that we have at CPW are publicly available. So everybody around the world can access and use them. To find a solution, you have 2 options. One is to find by work, like you see that. This is this line of work or the trade or the activity. Electrical excavation, heavy equipment installation. You see that the long list of activities that you can find solutions related to each of these. The next option is based on the topic. And this is the way it works. You see that a long list of hazards and topics available here, like noise, right? So we click on that.
Hello.
And we see that 29 solutions available specifically for noise. And you can select whichever, let's say, you are looking for some quiet jackhammer for your operation. This is the solution available for that one. If you click expand, so you see the description, if any statistics or if any standards and regulations available for that we have presented, risks addressed, how the risk is addressed, and also some additional information. On the right-hand side of the page, you see availability. These are the related products available for this specific condition. And the manufacturers, you see that we have provided their contact information, and users can go and reach out to those manufacturers and get more information. And also we have provided other related solutions for the same topic so that you can go and use. This is the way our construction solutions database works. Again, we have a long list of solutions, over 350 of them. So for a wide range of topics, you can go and search, and based on the need of your project, you can pick up some solutions and some information that you need. And if you have any questions about that, you can also reach out to me, and I will share that with my colleagues. And if we can help with that, so we will do it. If you have any topics of interest that you would like to work on that with us to develop a solution around it, again, reach out to me. So we would be more than happy to work with you. Or if you have any data available for any of those hazards that I presented as part of our exposure control database, silica, welding fumes, lead, and noise, we would definitely appreciate it if you could share with us, and we use it to strengthen the database, because it is a database and we need more data to make it stronger. So with that, I would like to conclude my presentation. And if there is any question, please let me know. Dr. Alberto, stage is yours.
Yeah, that was awesome, Babak. I really appreciate you sharing with us a really neat tool that's evidence-based with high quality, and so many opportunities to engage the tool, depending on whether it's on topic or task. I think that's fantastic. I want to encourage our attendees who are in the webinar, if you want to ask Dr. Marian any questions, please pop them into the chat so we can ask him, or if you feel comfortable, unmute yourself and ask away. While we're waiting for questions, I wanted to ask you about the frequency for the updates, and perhaps I missed this, so I apologize. The updates are done in real time as new information is provided, or is there like a reflection once a year that the team goes together to go back, review, and update different content that's available? How does the sort of
That's a great question. Sometimes, so we have, sometimes we randomly, for the solutions, for the second one that I presented, some content is common from old days, we developed maybe 10 years ago. So we try to go and kind of audit the website and see what's available. Sometimes links are broken. Sometimes those manufacturers are no longer in business. They're out of business, right? It is a major challenge, but we try to audit that sometimes randomly, sometimes based on notice that we get from our users that they say, hey, Babak, this link is not working. Or if they have a new product, we go to conferences, we go to expos, and let's say for heat or noise or silica, we see some new products come into the market, right? So we try to add them as we learn. And we heavily rely on our users and industry practitioners as well. If they have anything, if they have developed anything, or if they have any need, so we try to update the content based on that. So if I answered your question.
You sure did. I mean, it is, as I could imagine, with different companies changing, that it's hard, but it's an excellent tool. I mean, having it from all those different lenses with that level of detail is fantastic. Very practical for the occupational health and safety practitioners as well as industry. So thank you.
Sure.
Okay, so we'll go ahead and begin with our next presenter, who will be no stranger to this group. Next is Dr. Krishna Nirmalaya Sen. Dr. Sen has been working in the occupational safety and health in construction for 3.5 decades. Presently, he leads the EHS Department of Minerals and Metals at SBG of L&T Construction in India. He's a chartered engineer and fellow of the Institution of Engineers in India, as well as a professional engineer. He's a member of several professional bodies, including the National Safety Council of India and Institution of Occupational Safety and Health in the United Kingdom. He is a fellow of the Collegium Ramazzini based in Italy and professional member of the American Society of Safety Professionals. He also, as you know, serves as our leader and chair for the Scientific Committee on Construction Industry. So please join me in giving a warm welcome to Dr. Sen.
Thank you, Dr. Alberto, for the kind words. I will try to share my presentation. Yeah. So is it visible now?
It is, yes.
I'll continue. I'll try to make it. Yeah. So if it is this
Perfect
presentation mode is visible? Yeah. So I'm going to share some thoughts on the chemical health hazards which we find in construction industry and what are the possible ways to mitigate those from engineering perspective. You see, and then we have I have a big dashboard here, but I am not going to explain each one of them, but I am just going to highlight some of the areas like from the process point of view. If we see civil activities comes at the beginning, so we have the piling, we have excavation, then we have waterproofing. So we have tried to put those hazards as it emerges as we start a project with various activities. Of course, it is not capturing all those activities which are possible, but then this gives a big sort of idea in a large scale that which are the chemicals which are coming in each of those processes, part of the construction activities, and what are the chemical hazards which those specific chemicals or agents can bring to the people who are likely to handle it, work with it, with varying nature of exposure time and varying degree of exposure, because some people will be close to the application, some will be in the periphery. So the hazards, exposure to the hazards will not be same for the whole group, but it will of course vary to different groups in a different way. So I think, I mean, with all the specific activity-wise chemicals, we have to have the control measures, properly. Now, since I'm not going to talk much about the physical hazards, I'm going to talk about primarily on the health hazards, and we can, of course, look at it in multiple ways like carcinogenic, corrosive, highly toxic, irritants, etc., etc. As I come from the engineering background, we primarily use this hierarchy of control very much with elimination, substitution, and engineering control, administrative control, and PPE as such. So here we can definitely look at those chemicals or the health hazards which are being brought or coming to the workers who are associated, not only the workers, I mean, we all are workers in a way. So various category of the people, including the supervisor and the management staff. In the legal way, everybody is worker for that matter. So how that can be, brought down, and we use this hierarchy of control. But in many cases in construction, the elimination and substitution has its limited possibilities. So we depend on engineering control to some extent, administrative control and PPE together. Because when we are not able to eliminate and substitute, we have to have combination of the lower level of controls because they are less effective in the real case. So we also use a risk index to determine the probability and severity and then arrive at that. So for example, if we see a couple of exposures which we need to address when we are in the construction business, like we have silica, we have lime, we have chromium 6 hexagonal chromium, and then other things like admixtures, polyurethane, and then bitumen. So these each one of has its own health hazards. But the control probably in some cases will be engineering control to have improve the ventilation, to have the knowledge awareness, as Dr. Shao has been telling in view of the heat stress, and of course in others case, so people knows about it, the standard operating procedures for that matter, the MSDS, and then followed by some amount of PPEs. But as we know, these PPEs have limited effect unless they are properly used and properly maintained. That can have challenges. So, but this is other way I think we can approach, but because elimination and substitution may not be possible. And then other, like processes like welding fumes, you have aldehydes, we have oxides of chromium, CO, fluorides, and NOx, and even ozone. So for each of these, possible health risks, different sort of manifestation will happen to the human body, like irritation to eyes, metal fume fever, lead poisoning, uh, lung diseases, dermatitis, and so on, including headaches. So again, the control can have multiple way we have to look at it. Some places engineering control may not be possible, but we have to then have more sort of awareness, job rotation, sort of acclimatized people deployment, and then of course have specific PPEs for that matter. This is, I mean, if you have when you do the thing in a workshop, you have chances of having a very standardized way of controlling it to a more effective manner. But when things are done at the projects, the things may be very, very difficult, but some sort of local arrangements can be made to ensure that the breathing zone of the worker is not much, polluted with the product of the welding, etc., etc. And then other, like, for example, a lot of solvents are being used for construction processes, paints and things like that. So those have known health hazards, the nervous system, skin, and also including the damage to the reproductive organs, liver and kidney, and things like that. So there could be, now we are also going to a process of changing those chemicals. Some of the cases, the hydrocarbon-based solvents have been, replaced with water-based solvents. This is a way of substitution, and then, of course, having the respiratory protection. This is, of course, a sort of display of various types of respiratory protection, which can be made available depending on the risk of the activity and, of course, the controls which will be most suitable. And then fiber, we need not, overemphasize, but we all know that the asbestos is a major problem. Unfortunately, though in many parts of the world, particularly developed world, this has been, banned or very, very limited. But unfortunately, in LMICs and countries like few countries like ours, asbestos is yet to be formally banned. But then what is happening? Sometimes manufacturers are aware that the people are not willing to buy asbestos, so they are now calling it cement fiber. So we have to be very careful about cement fiber, because some of the cement fiber are non-asbestos based. They are nearly 30% costlier, but they are much safer than the asbestos. And that is why I have mentioned that we can go for elimination and substitution, because elimination means some of the cases you can completely eliminate asbestos, particularly for roofing or cladding purpose. Now asbestos is many major companies with ESG and SDG coming in picture are eliminating usage of asbestos for their own purpose. And substitution means if you have to use asbestos, I mean the cement fiber, then we have option of selecting non-asbestos based things, and then of course toxicity because of the other solvents which I have just. So the exposure limit will definitely vary, but I mean, and we have to ensure that as minimum as exposure possible for asbestos can be done. Now, Now for nitrogen is basically is asphyxiating gas. It is not a poisonous gas, but we had cases not in my organization, but we have come from the industry, reports that people when they purge nitrogen to clean the tank, and if it is not again aerated properly, people can go in a nitrogen filled tank without understanding that it is full of nitrogen and lack of oxygen of the required percentage, and there can be instant death. And it has come to notice that some of cases, 2 or 3 or more people are gone one after the other, and because of the lack of knowledge and awareness and oxygen concentration measurement, a couple of people have at one go gone one after the other. So similarly, the CO and all, because there is no there is no smell both in nitrogen and CO cases. So it is very important that there is proper diagnosis, proper administrative control like measurement, engineering control like ventilation and things like that are to be controlled. Anyway, this is a simple picture of where the exhaust can be dangerous unless it is properly vented out. Now, wood dust is another process where a lot of dust is created, and this can have multiple risks, including risk of cancer. And it is important that those dusts are properly taken off and having the proper ventilation and things like that. And for example, varnish and solvents are also used where we have to ensure that the chemicals which are being used are less and less problematic, with proper assessment of those chemicals and using the hierarchy of control, whichever is possible in the particular case of the chemical. Transportation and machineries, large number of equipments and machineries are used in construction, particularly in major projects. And depending on the nature, if it is a tunnel project or hydroelectric projects or metro projects, depending on the project type, sometimes there could be exposure to those chemicals because of lack of ventilations and lack of change. The number of air change per hour can be varying, and then there can be problem of various leading to various health issues. And similarly for gasolines and all, this can also be problematic. And control is basically to have mostly on administrative control and personal protective equipment. Yes, radiography is another process which mostly used to check the firmness or check the welding quality of metal welding, metal to metal welding, and those are done on site. So those those are brought to the location through the lead boxes. But there are some number of people, particularly those conduct it, and those who are nearby to assist this process have the chance of exposure. Unfortunately, I came to know in some cases each of them have a dosimeter, and the dosimeter has to be checked by the government authorities to allow them to continue to work or have 10-15 days or months of rest to reduce the exposure on the body. But sometimes the people who are associated with the process do not use it because they do not want to be laid off, or they do not want to miss their work or miss their earning. Unfortunately, so it is very important that the people who are responsible for this ensure that the dosimeter is used by the people who are doing, otherwise they can have a serious risk of being permanently affected by this type of radiation. Silica, of course, sandblasting has been banned to in most of the countries, but the materials which are being used for the flooring, those are being cut. So sandblasting has been stopped, but in some cases sandblasting is also done with a special permission from the authorities because of the quality requirement. But the exposure to silica can come from various other sources like cutting of tiles and stones and things like that. So again, it is important that the people who are exposed to those silica dust have proper protection, there is proper ventilation, and also awareness and supervision and checks through the management experts. Coming to other processes like battery, a lot of batteries are used for the vehicles, and they are required to be, charged repeatedly, and then there could be exposure of because of breakage, replacement, maintenance. There could be exposure to lead and also H2SO4. So exposure to lead or H2SO4 will have the consequence like if the lead goes, those who are maintaining those batteries, cleaning and doing the things, and also dealing with rejected batteries, they will have those problems. And then, of course, coming to H2SO4 and things like that. So ultimately, the focus will be basically on prevention. The chemical hazards, chemical health hazards are there in construction. We cannot completely eliminate it, but it is very important that the management or the leadership people in the construction industry, those and also those who are aware about those hazards, take it to the people who are mostly vulnerable to this, identify those hazards, train the people, identify the risk, and according to the risk assessment, take action. So with this, I just wanted to thank all the people who are participating in this program, and I would like to hand over to Dr. Alberto for further proceedings.
That was wonderful. Thank you so much, Dr. Sen, especially for highlighting all the different chemical hazards and opportunities for countermeasures for controlling and mitigating them. I do see we have a question here in the chat, so I'm going to pass it over to you. It says, sometimes the effect of chemical or agents are coming to known detected after a long time of work, like after 8 to 10 years, probably talking about cumulative exposure, I suspect. So it is very difficult to detect in the very beginning. How do we generally handle this type of case?
Yeah, a very good question. Thank you, Mr. Mukherjee. Now, you see the manifestation of those chemical exposure can come 10 to 12 years later, or, like, for example, asbestos. But we have to be, we are aware about those probable outcomes, even if the manifestation do not happen today. So from the management or from the leadership point of view, when I am bringing those chemicals to my premises, or I am asking my workers to handle those, we should be aware about the probable, because of the global study and global reports, we are aware about which can happen. So one is that if the person is continuing, which is not in construction, because they keep on changing the companies, and it may be very difficult to establish in our countries like us, in ours as of now, because we don't have that data tracking, but it might come in another 5-10 years with the digitalization way we are going. But as of now, it is the responsibility of the management when we are making someone to get exposed to take care of him or her at the beginning. So I think that is what we can do as of now. But once we have the data, like in US or in other countries, we will be able to track the employment data and his exposure data, perhaps. But it is a challenge as of now for us. Yeah.
Yeah, absolutely. And data management, right? Like you said, like having opportunities to track longitudinally across the movement of the workers is very helpful to inform occupational health and safety measures. So thank you so much, Dr. Sen. That was an awesome presentation. So we're gonna just move on to our next presenter so they have sufficient time and can get everything on time. So it's my distinct pleasure to introduce Dr. Rick Reinhardt, who serves currently as the Deputy Director, also at the Center for Construction Research and Training in the USA. He supports CPWR's construction research, training, and service programs and engages with CPWR's external partners in either government, construction unions, and the larger construction safety and health community. He holds a doctorate of science in occupational health and master's in industrial hygiene from the Harvard School of Public Health, our alma mater. Previously, he worked at the National Institute of Occupational Safety and Health and OSHA in the US and has done considerable work over the years with the ILO on global safety and health issues and hazardous work by children. Please join me and let's give a warm round of applause to Dr. Rick Reinhardt.
Well, thank you, Dr. Alberto. I appreciate it and welcome everyone. I'm very happy to be here. Can you guys see my presentation?
Yeah.
We can in presenter mode, yes. Okay,
perfect. So again, I'm Rick Reinhardt. I'm the Deputy Director at CPWR, and I'm happy to be here. And one of the things I wanted to, I guess, start off with is just to emphasize how important I think that the topic of this webinar is. And it's really, because, and I think this kind of got into the last question to Dr. Sen, is that health hazards associated with construction, they're frequently ignored, mainly because of the difficult or the failure to connect workplace exposure to the various illnesses that they cause, and often there is a long latency period of exposure and disease, and because of that, there's massive underreporting of occupational illnesses, and particularly in construction, and that's in every country in the world. So today's presentation, I'm going to highlight some resources that are designed to help employers mitigate and prevent occupational health hazards. So these are very practical tools. Before I started, I want to just briefly talk about where I work, where BOBIC works, and just kind of put in perspective where we're coming from. And we're a nonprofit organization, and we were born out of the North America Building Trades Union, which NAPTU, which represents over 3 million workers in the US and Canada. And we're very mission driven. And our mission is to reduce injuries, illnesses, and fatalities in the construction industry. And since 1990, we've been funded as the NIOSH National Construction Center. And NIOSH stands for the National Institute for Occupational Safety and Health, which is part of the US Centers for Disease Control. And as the National Construction Center, our mission is to try to move the needle on injuries, illnesses, and fatalities in construction throughout the United States, union and non-union. And we receive funds. We fund a lot of our own internal researchers like Dr. Bobic, but we also fund a lot of researchers in universities throughout the United States and have been doing so for almost 30 years. We have a lot of partners. We have a large consortium from private industry, insurance companies, trade associations, occupational environmental health organizations, government agencies, and as I mentioned, many universities throughout the US. And one of the main things that we do is to try to translate the research that comes out of this work into practical tools and information that can be used at no cost by anybody. And I think I'm going to skip this slide just for time. This is just highlighting that our organization, we have 3 sort of legs, that they're not siloed, they interact with each other, and I'm really going to focus on the one in the middle, our National Construction Center, and the products that have come out of that. And specifically, I'm going to be talking about our research to practice program, which again, the aim is to translate research into useful resources that are available to all at no cost. And one way to think about this is in these 3 buckets of research translation, which really you think about how of the research that's being conducted, how can the findings be sort of converted into something practical that can actually be used by employers, workers, unions, anyone else in the construction industry. Dissemination, it's a huge challenge in the construction industry. It's so fragmented, and as was discussed earlier, it's a lot of sort of informal sector. Even in, I think, a lot of developed countries, when you get down to the small construction employers, they act very much like the informal sector, and they're very hard to reach and identify. And we do this through different partnerships. We have a very big research to practice library, or an R2P library, that is available to anyone who wants to look. This is kind of divided into 3 areas, and on the left is that we've created some specific tools for researchers who are doing work on construction safety and health. And we work with all of the researchers that we fund and many that we do not fund to try to think at the planning stage of how their research could be used and sort of expanded to construction companies, to make a difference. And we've created something called a R2P roadmap that can be used at the planning stage or design stage of research projects, and also throughout the project, to try to make sure that your findings can have some impact in reality. We also have a lot of tools and guides on ways to reach vulnerable workers, build partnerships, and really the last bit here is where I'm going next with this presentation, is just some of the practical tools and things that we've created. So this is a screenshot from our hazard specific resources webpage. This isn't all that's on the webpage, but this highlights some of the materials, again, that are free to anyone, that I just was going to talk about today, from hazard alert cards, infographics, physicians alerts. For example, our physician alert cards, they're designed for a worker to take to the physician or their doctor when they go see the doctor, and it says, I'm a construction worker, I've been exposed to these materials, please consider this when you're doing my evaluation. And we have those on a variety of different hazards. We have a big suite of toolbox talks, which are very important and practical in the construction industry, and a lot of other materials as well. I'm going to focus right now on some of the hazard alert cards we've developed that are related to health hazards in construction. Here's some examples from asbestos, lead poisoning, isocyanates, silica, nanomaterials, epoxy resin systems, fumes and gases, carbon monoxide, working in the heat, solvent exposure, paint stripping, beryllium, RF radiation, and noise and hearing loss. We have a lot of these cards on many topics, and again, they're free, and they're available in 2 formats. One is, anybody can go to our website and download the PDF, which is a 1-page document, and you can do whatever you want to do with the PDF. And we also have foldable pocket-size hazard alert cards that are made out of durable material. They're waterproof, they're made to last, and they are often used during training programs, handed out to workers, or toolbox talks. And in the United States, anyone can contact CPWR and we'll send the hazard alert cards to them for free. We can't do that globally. However, if anybody wanted to produce or print their own of these hazard alert cards locally, I think we would definitely be happy to provide any of that kind of, or any information or details to make that happen. We have a heat hazards topic page. This obviously it's a big issue in construction, and talked about it during this webinar quite a bit. The box on the right shows just in the US that while construction represents about 7% of the US workforce, it experienced almost 40% of the heat-related deaths in 2020. This work that we've done on heat hazards is through a program, an alliance or partnership program with the Occupational Safety and Health Administration, or OSHA, in the United States. And we've produced various practical things like heat illness checklists, daily checklists that could be used, very simple. And I put the QR codes here for our topic page and also the OSHA webpage. We've talked about silica quite a bit today. We have a website called silicasafe.org. As you know, CPWR has created several, or quite a few, like a whole suite of different websites. Babak earlier talked about two of them, the exposure control database and the solutions database websites. This is another one, and this one is really meant to be a one-stop source of information on how to prevent a silica hazard and protect workers. And it's very simple and straightforward. Explains what the hazards are, different controls. And I think one of the sort of very positive things about this is that it's kind of action oriented. I mean, when a user can go through it and actually create a plan that's tailored to their specific work site and come out with something, very concrete for the work that they're about to do. We have another website called Best Built Plans, and this kind of gets into how some of the issues that Dr. Sahu was talking about earlier. This is on sort of trying to plan out at the planning stage of construction work, lifting and material handling hazards. And this kind of is along the same lines of an ILO training program from decades ago that some of you may be familiar with, higher productivity and a better place to work. And that's really the philosophy behind this. It's if you plan out and do have safer lifting practices, you're going to be more profitable. You're going to reduce injuries. You're going to reduce insurance costs and whatnot. We have a large resource now on mental health. I don't know how relevant this might be to everyone on this webinar, but globally, for example, suicide is definitely a growing concern. And in countries where there's data and they've looked at people who've died by suicide of working age and where they worked, construction always comes out near the top, and there's no exception to that in the United States. We have a big problem. We also have a crisis in the U.S. on opioid overdose deaths, and construction, again, when you look at people who die by opioid overdose and where they work, construction's at the top. We have partnered with a lot of different groups, and this is it's an area that kind of, I would say in the last 5 years has really grown tremendously for us, and I know some colleagues in some other countries, but so we've been doing a lot of work in this area. We have a lot of webinars that we conduct, and I just today, or when I was pulling this presentation together, looking at some that I thought might be worth sharing, and particularly the first one is a joint webinar with the American Industrial Hygiene Association, AIHA, and it's on addressing the 4 major health hazards in construction. And I think it's very relevant to the topic of today's webinar. For anybody who's worked in the construction industry and safety and health, we're probably familiar with the term the focus 4, and that typically refers to falls, struck by, caught in or caught between, and electrocution as the major 4 hazards that end up with fatal injuries. Several years ago, AIHA put together a publication called the Focus 4 for Health, or the 4 major construction health hazards. And what they ended up with were things that we've talked about today: manual material handling, noise, air contaminants, and high temperature. So and I've listed some other webinars here that might be of interest. Again, heat, suicide prevention, exposures to isocyanates, other reactive chemicals, and there's also one on noise. If anybody wants to dig down into more information, I recommend that you check out these webinars. They're all available for on-demand view on our YouTube channel, and each of these, for most of them anyway, you can download the PowerPoint that goes along with them, as well as other related materials. So this is my last slide, and I'm just curious of how many people on the webinar today have taken advantage of the free NIOSH Noise app on their phone. This is it's an incredible app. Unfortunately, it's only available for iOS devices or iPhones, but it's can be used with an external microphone, and actually, when it's calibrated with an external microphone, it meets the Type 2 requirements for sound level meters, and it's totally free. I highly recommend, if you don't have it and you have the opportunity to use it, or you have a colleague who has an iPhone, I recommend you get it and you start using it in your workplace. So with that, I will end, and I'm happy to take any questions.